about adverse effects of physical inactivity. Physical activity induces cardiovascular fitness, increases muscle mass, and healthy blood glucose regulation while reducing visceral fat, triglycerides, and low-density lipoproteins. Sedentary lifestyles or inactivity promotes adipose tissue accumulation that generates systemic inflammation and oxidative damage. Exercise, however, demands commitment, time, energy, stamina, and persistence. Exercise is not concerned about your time restraints or career responsibilities of movement restriction due to neuropathic pain or chronic pain or individual choices. Now, over 1 billion of individuals are obese globally. Effects of exercise on a healthy body. Basically, exercise, fitness, and weight loss, blood flow, and energy. So, glucose energy, hyperglycemia, testosterone decrease, and stress eating. This is what the exercise does. So the good part is that you have fitness and weight loss. However, there is an increase in inflammatory cytokines like interleukin-6 and hyperglycemia. And also there is a decrease of testosterone and an increase of cortisol with exercise. And again, it's very important, but it has its downside. Excess body weight promotes insulin resistance, increases blood glucose, diabetic nephropathy, and neuropathy actually, and the non-alcoholic fatty liver. Now, obesity plus insulin resistance creates the type 2 diabetes, hypertension, and cardiovascular disease. Cardiovascular disease kills about 1 million individuals yearly. Diabetes, hypertension are associated with COVID-19 mortality rates and very high mortality rates of COVID-19. So it's not a good thing. Basically, it creates a lot of problems. Imbalance between intrahepatic triglycerides production and export creates visceral fat, we call it VAT. That creates more triglycerides, lipotoxicity, inflammation, non-alcoholic steatosis, which is the fatty liver, and basically cirrhosis in the end. And this is the difference between healthy liver and this is the fatty liver. Here is fatty liver, and you can see how basically it's completely damaged. Now, COVID-19, the VAT, which is the visceral adipose tissue, increases the chances of you getting COVID-19 and also staying in the medical ward much longer, because the COVID-19 has an affinity for fat cells, for ACE2 receptors in the fat cells. Muscle, however, has the least ACE2 receptors. So basically, the fat has the most and the muscle has the least. So what you want to do, you want to exchange fat with muscle. And that's going to be an additional protection. So even if you do get COVID-19, you're not going to be overwhelmed by it. Now, 16 minutes of low-level laser therapy combined with 1 hour of aerobic exercise reported visceral fat reduction, however, no differences in BMI. Now, a follow-up study actually found no visceral fat reduction by the same investigators. Now, randomized placebo-controlled data demonstrates some modest reduction of visceral fat at post-issue and fatty liver improvement followed 8 weeks of aerobic exercise. However, again, no differences in BMI. But exercise works. It's just that it takes a very long time and it requires a very substantial effort. This is the scientific research of the articles that I have published. They're all mostly 2020, the ones that we see here. And there are more articles from the Journal of Aesthetic Nursing and Scientific on a lot of them on COVID-19, some of them on diabetes, and basically describes the propensity of COVID-19 for fat cells and how it's kind of does not affect the muscle cells as much. And this is the design of our study. Basically, we did a blood test before and after T3. We looked at CRP, which is inflammatory hormone. We looked at fasting NPP insulin in pre-diabetics and fasting NPP glucose in diabetics. And then we also, 11 subjects had a sonogram before the first treatment. And then we basically tested everybody after 20 treatments. This is people that all of them had some kind of a medical disorder. And we used this effortless simulated exercise technology that has a basically 8 seconds full body contraction. And I can show you what this looks like. We're going to observe now the contraction opening up, opening slowly, 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 slowly. The way you sort of lift up weights very, very slowly. And this is how basically it starts, utilizing a lot of fat, both subcutaneous and visceral, to build the muscle. This is some of our results. There was several studies involved in this, and we found a BMI decrease of 23.46%. Overall fat was minus 23.8. Mean visceral fat decrease was minus 29.3, and mean skeletal muscle increase was 41.6. Again, different subjects had different responses. BMI decrease, again, is the same thing. Visceral fat decrease, minus 47%. Actually, this is a different study, that follow-up study that we did, and again, overall fat was 23.8, and visceral fat was much higher than the previous study. And the muscle mass was about the same, in 41.9. This is the results on blood glucose and PP, postprandial glucose, and the results on fat liver as well. There were 11 subjects that this is the diabetics, and here is all the pre-diabetics and the results. You can see the insulin decrease was 41.8, it was minus 54.52, and the insulin decrease, PP was minus 44.7. And here is the pre and post treatment results on fatty liver and sonography reports. You can see fatty liver previously, these are all diabetic patients, and no fatty liver after the 20 treatments. And they did 20 treatments because pre-diabetics and diabetics are far more resistant to losing weight. Triglycerides was a minus 22.88% decrease, and average increase of the high density lipoprotein was 30.34, which is something that you want. You want the VLDL and triglycerides to decrease, and you want the HDL to increase. You want the cholesterol to increase. And again, free-to-free was a significant increase of 40.78. And the CRP, that is, these studies were the only ones that looked at the CRP, the C-reactive protein, which basically is the best marker for inflammation, and we found a significant decrease of 37.88%. Now, this is the table of the statistical results, and you can see there was a significant significance in all variables, both blood glucose, blood insulin fasting, and insulin BP, triglycerides, and also upper abdomen reduction. CM was again 965, about the same as that we found in previous studies. Umbilicus was 10.32. Lower reduction was 11.5. Skeletal muscle mass was again very significant. HDL was significant, and the this is again some of the before and after results. The subject allow us to use pictures. This is after 15 treatments. Again, after 15 treatments, before and after, the results. And that's also after 15 treatments. This is from a different clinic. Other studies performed with the same technology looked at the review of COVID-19 associated factors, CRP, creatinine, bilirubin, VLDL, triglycerides, cortisol, and function. And again, found very significant results. That's the blood test results on creatinine and bilirubin. These are all associated, these are all markers of COVID-19, as a matter of fact. And again, it's we looked at diabetics and pre-diabetics, and the results on creatinine, there was a reduction of 19.67, and bilirubin was 69.23. CRP, again, a very high decrease in CRP of minus 36.87, and cortisol decreased quite significantly in this study at minus 17.47%. Blood tests that also looked at VLDL and triglycerides, and we found a VLDL decrease of minus 8.13 and triglycerides at minus 14.9%. There's this table of all the statistical significance of this particular study: VLDL, triglycerides, free bilirubin, creatinine, CRP, cortisol, HDL, visceral adipose tissue, BMI, and measurements in umbilicals. There were all variables were significantly, very significantly, very statistically significant. This is again our clinical board, and that they are basically involved in different of our studies. There's a lot more clinics that are participating right now in research. I don't have the doctors for them. And with this, I would like to thank you very much for your kind attention. And if you do have any questions, I'll be happy to respond to you right away if you email me at science@iellios.com. Thank you.